This is the Candidly Kim podcast.
Welcome to the Candidly Kim podcast. We've got a great show tonight, and Doran Barton, our producer, again with us tonight. And say hi. Tell us, give us your spit take joke that you just showed me.
Oh, that one. Yeah, there's this. It comes from the Babylon Bee. This headline: Governor Cuomo generously offers to admit Trump to New York nursing home.
I bet he did. I bet he does. Okay, this is exciting. We have Dr. Mary Tipton with us tonight. And if you followed us during the campaign, we had a great time with her early in the COVID pandemic. And so let me just tell you a little bit about her. A lot of people have asked if we were going to have her on. So very excited. She's one of my doctors. So she's a local community doctor. She is one of the partner owners of Copperview Medical Center, which is just kind of your local clinic, not part of one of the big healthcare systems. And I think that's one of the things that makes Dr. Mary Tipton's experience unique. And sometimes you have your medical professionals that are part of big government bureaucracies, some that are part of big systems. But Mary, and it's not a small clinic by any stretch, but I think Mary has been called a unicorn in the industry. And I think it's because she really has observed not just the exam room, but the whole, top to bottom of running a clinic and seeing the patient experience 360 degrees, what they go through with their insurance companies, with trying to access just good health care. And she's witnessed the barriers to that sometimes, barriers to some of just the problems with insurance, problems with regulation. And so I noticed a couple years ago, again, Mary is a constituent of mine, so lives pretty close. Our kids go to school together. And here's this clinic kind of in my neighborhood, in my community, and I've gone to for years. And started noticing that Mary speaks up on some healthcare issues, and I thought this is someone I need to get to know even a little bit better. And namely, I think when I really started talking with Mary on a specific healthcare policy called PBM reform, our pharmaceutical management, pharmaceutical benefits managers. Middleman. And maybe you'll share a little bit about that with us. But so I'd like to welcome Dr. Mary Tipton, our local hometown doctor and clinic. And welcome, Mary.
Thank you very much for having me.
So exciting things, I think, that just last week I'm working from home, as so many of us are doing, and I've got Fox News in the background, and I'm like, oh, there's Mary. Oh, Mary's on TV again. What's going on? Well, it was a press conference that President Trump was holding, and he was going to announce his new health care proposals, and there was Dr. Mary. So Mary is one of the few doctors nationally and healthcare professionals that were invited to serve, particularly as advisors to President Trump, his campaign, and medical practitioners for Trump. Did I get it right?
It's medical professionals.
Medical professionals for Trump. So where do you stand on the presidential election?
I'm definitely in support of Donald Trump. I feel that the things that he's done in healthcare and will continue to do if reelected are essential to preserving the physician-patient relationship. And I'm quite frankly terrified of the alternative, which is a government takeover of our healthcare system.
Wow. So now I think it's pretty special that I know you, and I've seen your work, and I know your dedication to the patient and to bringing good, positive change to the industry. And that, yeah, one of our own here in Utah, one of our own in my community, to be invited to serve as an advisor to the president. I think that's pretty awesome.
I agree. I am not special by any means. I'm not rich. I am not contributing large amounts of money. I'm not being paid to do this at all. So what really sets Donald Trump and his administration apart from others, Republican and Democrat, is that he has solicited opinions and listened to them from practicing physicians. And as you mentioned, I am a practicing physician, also business owner, mother. And I think those things influence the way that I see healthcare, and in a way that an employed physician cannot. For example, you mentioned that the announcement for Trump's healthcare policy and plan, which was on September 24th, had physicians in attendance. That's true. A lot of physicians, also nurses, other health professionals, and these are all just doctors like me who take care of patients every day, practicing physicians. And for him to invite and include us in the conversation before, during, and after is significant. We're not big money. We're not the hospital association. We're not pharmaceutical companies. We're not insurance companies. And in the past, those have been the people sitting at the table, and thus those are the people benefiting from the plans. So it's unique and striking, I think, that he would, listen to someone like me.
And you're independent in a different way than some of the other practitioners in the sector. I just feel like I feel proud of you and your involvement. And really, I think I don't even know if you were political a few years ago when I met you. I watched, you're very prolific in Twitter, and I'm always giving out your Twitter handle, so I don't know if you're seeing that. But that you just talked about the policies that are crazy, the things that are barriers to you just doing your job as the healthcare provider. You like to say you want to keep government out of the exam room, and firsthand, because you own the clinic, you know the business side of healthcare as well, that you've seen where government policy may get in the way of better cost and better access. So that's when I started watching you on Twitter and seeing you really start to expose a lot of those things, bring some awareness on those things. So I don't even know if you were political, but
not much. I'll tell you that. I think like most physicians, we keep our head down. We see patients. We just try to do what we're told and do the right thing. Physicians want to help patients. They go into it for those reasons. And yet it's becoming harder and harder to do so. So I've been practicing for almost 20 years, 15 years in private practice after my training residency. And so I know what it was like before the Affordable Care Act, during, and now 10 years into it. So I have seen the increased bureaucratic red tape, the onerous guidelines that are pushed upon us, that are pushing small businesses and private physicians out of practice and into employee groups. And I've seen those changes dramatically in our own community and nationally. And so just about 3 or 4 years ago, when I started to learn about some of the background for prescription drug pricing, I honestly could not believe that it was the way it was. I just was like, wait, but like, really? So really there's middlemen that jack up the prices 80% and don't benefit anyone in the supply chain or even make the drugs. And so some of the things that I was learning just, I guess, radicalized me in a way.
in a good way.
Funny that the truth, just the truth could radicalize you, essentially, because that's all it was. I mean, I'm just learning, these are the reasons behind it, and they really make sense. None of the reasons that people have given me for increased drug prices in the past have really made sense.
Okay, so give us an example. We talk a lot about, for instance, EpiPens and insulin. I mean, that one seems to, we all know somebody who has faced just this crazy rise in cost of insulin.
Yeah. Essentially, insulin, which is probably one of the most egregious examples of price gouging, is a good illustration of how the middlemen and all of the bureaucracy and the monopolies in the system increase prices. So simply, it's an essential medication. It's life-saving. So you have a kind of a captive audience there. Secondly, it is not a new medication. So they had to find ways to kind of continue to make money from it, which
Hold on to patents.
Yes, evergreening patents. So there's just a lot of nefarious type of marketing and pay-to-play politics that go on there. And then once it's created and you have a name brand insulin, it has to be brought to market. And so what you have is these pharmacy benefit well, first of all, there's pharmaceutical companies that actually make the product. Now, they actually have to study it, research it, figure out if it works, and do the studies for it. There's definitely cost to that innovation and to that production that is essential to ensuring that we have the highest quality medicines. But after that happens, like, for example, Humalog, which has been on the market over 20 years, I mean, it hasn't changed. It doesn't need any more research. So then they need it brought to market. And so then you have what's all these different middlemen in between the person who made the drug and then the patient who buys it at the counter. And so what we're finding is these middlemen, because they are allowed to, by laws that exist now in our country, they can have secret consolidated contracts that require the manufacturers to have a very high list price, which benefits the pharmacy benefit managers, and then they pass a lot of that on to patients. So truly, pharmaceuticals just cost too much. Our healthcare costs too much. Our insurance costs too much. And as time goes on, we're getting less and less. Patients are tired of it. They're tired of paying more and getting less. And I don't think it's right. So I'm here to speak up a little bit and share some of the truths that I found.
Okay, so as a state lawmaker, we tried to address that. I think in my last 6 years, there were several attempts to address. This last year, there were 2 bills that dealt with placing caps on the drug copay for insulin.
Right.
What does that do? I mean, does it fix the problem, I guess is my question, or is it just a Band-Aid? And, for one of the bills I did support because it wasn't a mandate, it was more kind of encouraging the insurance companies to kind of do more due diligence. But the other one really was placing a cap on a copay. But I thought, if we're not fixing the problem, you're just shifting. Someone else, now someone's heart medication is going to inflate there too. But I think we sincerely wanted to do something, but is that the right thing to do?
I think they were good bills. I think on the state level, some people in Utah have tried to do what we can. I mean, certainly this is a systemic problem that requires the attention of Congress, first and foremost, to require transparency for all transactions. So if we just had transparency on these pharmaceutical benefit managers, for example, who do play a role.
Okay, what do they do? Okay, so let's back up, because I know last time we had you, we explained it, but for people who might be seeing this the first time, pharmacy benefit managers are, like you said, middlemen, but they manage the formulary. And some people think they're only in the private market, but almost all entitlement programs, that's Medicare and Medicaid, are now having their formularies managed by PBMs as well. So PBMs are getting a blank check from our tax dollars in Medicare, Medicaid, and of course all the private markets to manage formularies. So what they do is they choose which medication will be placed at a different level on the formulary. And a higher level on the formulary requires more money for the patient, so a higher copay, more money out of pocket, less, preferred, we'll say. And then another medication that's more favored or a lower copay, lower tier, has a lower out-of-pocket cost. So they essentially, for fees, for kickbacks, they will place preferentially drugs on the formulary. So they are gatekeepers of market access, and they're very consolidated. So PBMs, this is the problem. There's 3 of them. That's
Express Scripts, CVS Caremark, and Optum, and they control 90% of every pharmaceutical transaction in this country.
Okay,
And
so these guys, the whole purpose of them existing was supposed to help manage the costs and to bring those costs down. And in a competitive market, but there are only really three main players, so that competition is limited. There are not a lot of choices in that market.
So anytime you have a monopoly, or in this case, an oligopoly of three, which forms a monopoly, you're not going to have true competition. The other problem is that they receive their money on the basis of contracts which are allowed to be kept secret. According to
Yikes.
So according to a Safe Harbor Act, which is from 2003, which not incidentally was when prescription drug prices have
skyrocketed.
Increase, they are able to keep secret the money that they make, and so they take a percentage of the list price. So what this does is like a realtor. If they're going to sell you a property, they do take a percentage of the list price. They have more incentive to sell you a more expensive home. Same thing with someone who sells you a car. So that's not really serving the purposes of the patient or lowering prices. I mean, to be fair, that's a perverse incentive that is by law given to them. So I feel that transparency, and I know President Trump and their current administration believes that transparency is truly the key to try to unravel some of these perverse incentives that have caused increased prices. And that's both with pharmaceutical companies and prescriptions, and also hospital costs and insurance, and basically all healthcare costs. So that's one of the key tenets of the plan, is transparency for Trump's healthcare plan, by the way.
So kind of wrapping up this issue with the pharmaceutical benefits manager, you mentioned kickbacks, and so most federal law, I think if not all of it, prohibits kickbacks. But you mentioned Safe Harbor, and when this Safe Harbor rule passed, the Safe Harbor was to allow and not criminalize kickbacks. So how is it that we've said that's okay?
It's a good question. I don't understand it, and I've asked every lawmaker that I come in contact with in Washington, D.C., and the basic answer I get is that, well, campaigns are expensive.
Wow. Okay, so a little bit of props here to Representative Paul Ray. He's been taking on the issue of PBM reform. Paul Ray, Representative Paul Ray, a state lawmaker. So I know he's been back and forth to D.C., and he's been working on also Congress passing laws, as well as our state trying to affect some policy at the local level on these PBMs. We can't affect the congressional safe harbor provision, but we should demand our state public health care systems to be very transparent with these.
And I know that the bill that he passed to collect information to try to find out if we are getting shortchanged or fleeced by the PBMs that manage our Medicare was kind of put on hold due to COVID this year, meaning they're not going to be able to collect the data that they wanted because of coronavirus. But I mean, it's still law, or the bill's on the books, and I hope it'll be worked on later for Utah on a state level.
All right. Well, and one of the ideas for that was to offset some of the expense to charitable medicine, to lower income, lower ability patients, and we just haven't really seen that. It did not trickle down to the patient, did not alleviate some of the cost pressure on our public health care and our charitable care. And so not real sure what they've done for us. But so I love that President Trump announced last year, actually worked on a policy to reform this system. Okay, so a
little bit more about that, because I was
please.
Pioneer Day for his executive order to repeal the rebates in the PBM Medicare Part D space. So just briefly, as you mentioned, in 2019, President Trump, through the HHS, declared that they wanted to go ahead and make those rebates illegal, and they call them actually kickbacks. But there was a lot of pushback that this policy would increase premiums for Medicare enrollees, and that's Not a popular political position to take, of course. So he reintroduced it this July. So what this would do is it would make that money, and again, this is 60 to 80% of a lot of pharmacy prices. So a lot of money. It's considered to be, I think it is 30 billion would be saved per year just by repealing or making those kickbacks that the PBMs get just for Medicare Part D transactions and out, and having that money go to the pharmacy counter to the patient instead of the manufacturer. Right now, the money goes from the PBMs back to the manufacturer or to themselves like that, but not to the patients. And so that's a very unpopular position with those who are still feeding from that gravy train and have been for a long time. So there is a lot of people scared about that, but I think that shows that Trump really fights for Americans and for patients, and that he will take what's a potentially unpopular political position to do what's right for our patients. And he did it at least on the aspect of what he can do, within Medicare. So that's just a start. To call them kickbacks, to have practicing physicians at the table, and to really stand up for that change is something that's never been done before by any administration.
Well, I know when he first proposed it back in 2019 or so, and that those talks kind of fell apart. The Congressional Budget Office was concerned that it was too much of an impact, and I honestly looked at that and I thought it's the too big to fail problem sometimes that the bureaucracy, that the systems, that the lobbies, all of those are so intertwined, and they were afraid of adverse impacts to reforming that. Then that I thought, here's another, too big to fail. No, we need to fix these things, and so I'm glad that he stuck with it, and that you've been able to advise the president and his team on this policy. So, what can we expect on that?
For the pharmacy benefit, or
anything can generally. So your statistics deal with our public health care system, right? Our Medicaid, Medicare system. What about the privately insured? For those of us who may still be privately insured because the ACA has not wiped it all out yet. What else? What else can you tell us about, and generally about other reforms that the president is looking at?
So essentially, this idea, the Affordable Care Act brought in, of having insurance companies that cover, and insurance plans that cover absolutely everything, I think has to change. It's an unsustainable model. So what I mean by that is that when you have an insurance that covers every single thing on your car, bumper to bumper, the oil change, the tire rotation, blowing up your tires, the color of your paint, whatever is included, it's going to be a very expensive plan. And it's really not insurance. So if patients want more choice and lower prices, we're going to have to realize that what we've been sold by the Affordable Care Act, or the current healthcare system, is not truly health insurance. It's prepaid healthcare at a very high price. It's premium priced prepaid healthcare. I mean, when we're paying $1,700 a month for all these private plans, my business, for all of my employees, that's like $24,000 a year. And then you still have a really high deductible. That is really not crisis care or coverage for unexpected events. I mean, it's prepaying for your healthcare that maybe you won't even need and maybe you didn't want. So healthcare needs to be more personalized. We can't have restrictions on healthcare plans mandating that they cover absolutely everything. We should be able to have insurance that is actually insurance, that covers like what happens if you get cancer, what happens if there's a crisis or an unexpected event. Primary care expenses, like at my business, can be covered and budgeted by most people. I mean, the things that I do for people are extremely valuable, and they're not extremely expensive. So in many markets, things like direct primary care, where they pay, where the physician actually sets fair prices, the patient pays for what they want and what they need, or you have like a membership plan for a month, has really been an amazing distractor or like has changed the game, saying, look, it can be done. Healthcare doesn't have to be so expensive. It's really not. It's this health insurance cost of healthcare that's so expensive.
Well, and it's kind of a factor of having a pool of people, and then where your risk goes with your insurance. But I've been an employer, you're an employer, where I've had to choose health plans, and it really is kind of the all or nothing. And I look at, as the employer purchasing a healthcare benefit for my employees, I'm looking at, well, I don't want their premiums to be too high. I don't want their deductibles to be too high. HSAs have been great, but I have a portion, so I look at what I have to pay for this, and trying to balance this with, what can I give my employees that is a good benefit to them, that also makes the job attractive, right? That I can be a competitive employer as well. And but you're right, so much of that I'm blind to. I mean, I'm looking at a chart with 80s and 20s all over the place. And but what does that really mean to the consumer of healthcare insurance, for the employer as consumer, as purchaser of healthcare? And the transparency piece is absolutely missing. I with my family's HSA, I do shop a little more. I do plan a little more. On the last podcast, we talked about, I guess I'll just say it, but we were audio for the last podcast because I had a spot of skin cancer removed. And it wasn't a fast-growing thing, but I could time it for when it all worked well. For my family's budget on the HSA, the co-pays on the kids' braces, it starts to put a little bit more choice into my hands now. I'm not suggesting that you don't have cancer removed until the budget works, but this was
It's estimated that 80 to 85% of healthcare expenses are pre-planned. They're scheduled. I had an ablation of my supraventricular tachycardia this summer that I've been putting.
Say that 3 times fast.
An ablation. I've been putting that off for 6 years. It wasn't a life-threatening situation, and I was waiting until the time was right. So that is something that I wish I could have shopped around a little more, to be honest, because I just got the bill for that. And it's really obscene how the lack of transparency. Hospitals and insurance companies are very, very, very committed to keeping the prices opaque, because the more they do, the less consumerism there will be. And if we can open that door, it will be revolutionary. I mean, if you remember back not that long ago when there was travel agents, just to fly somewhere, you had a travel agent and you had to call them and you had to figure out, and they would figure it out for you. I mean, nobody uses a travel agent now, because you can shop online and you can find out the price of this seat, the meal, what extras you want, what extras you don't need, and you can negotiate, not really, but, choose the price and the perks that you want for what you need. And there's really no other industry or situation in our economy where people are spending that much money with no knowledge of the price, no knowledge at all of price and even quality. In many cases, people are unclear. So that to me is wrong, and it fundamentally increases prices and decreases choice.
So it almost sounds like infusing the competition element into healthcare. Can you do that? Crazy idea, right? Competition in the marketplace. So Doran has a question for us.
Yes, I have a quick question, and you can tell me, is this if this plays into the cost of healthcare in general, and also if it's something that's being considered by the administration or by the group that you're in, and that is the employer's role when it comes to that you have to get your insurance through an employer or through a group.
Well, that's part of the ACA, right? I mean, it used to be that, it wasn't always that employers even offered insurance. That was part of competition, and that was giving a benefit in the public sector as well. But now the ACA says, no, you have to do it.
Right.
Yeah.
I would love it if my employer just said, look, we're willing to give you, like you said, $24,000 a year.
Yeah.
And you can take that and here's a voucher, and you can use it. You can use all of it. You can use some of it.
Absolutely.
You can pitch in some of your own if you want a Cadillac plan, whatever.
Right.
But I want to know, is that something that's causing the price of healthcare to be higher because we are locked into only the plans?
Whenever you're required, right?
Right.
Yeah.
You can
That
only
captive audience
choose.
you mentioned.
Yeah, you can only choose the plans that your
think
healthcare that your
stifles-
insurance offers.
Yeah, tying insurance to employers, in my opinion, is wrong and backwards, but it is extremely entrenched in our system before the Affordable Care Act, way back to like post World War II, I think, when businesses were trying to recruit people and have perks that they could sell, which is health insurance. So I don't know realistically, I have not, if that is an option that will be promoted. Although if we do have alternatives, then business owners will take it and patients will take it. Because like you said, Dorian, people can choose for themselves. If they know the health of their family and they know, what risk tolerance they have, they know how much savings they have to cover their unexpected expenses, then they could make a better choice with those healthcare dollars, I believe, than an employer who's mandated to provide and dump money into that bucket. And I think it stifles small businesses for sure, and innovation and people's ability to move jobs. So that probably has a big cost on our community and economy overall. At least that's what experts have said, that tying healthcare insurance to employers has effects on our job market.
Well, and also in particular that patients have not often been able to move employers, change insurance coverage because of pre-existing conditions. And I want to say that one really big and loud is President Trump supports being able to have that mobility and be covered for pre-existing conditions. And I mean, in my lifetime, I have just seen absolute just travesties of people not being able to move physically, change jobs, even if the next job was a better job with a longer term outcome or outlook for somebody, but for a child that has a condition that they just can't risk. It's just so, I mean, it's been such a terrible barrier in our system. So I love that President Trump is taking that on. And yet the Democrats are saying that he is against that. And no, he's the first one really saying he's going after that.
Right. A lot of ads on TV right now for a congressional district that I happen to live in, saying that the Republicans are going to take away health insurance and steal coverage from people with pre-existing conditions. This is a lie. There is no truth to it whatsoever. This is a fear-mongering fictional story that has been perpetuated by Democrats for years. And President Trump literally doesn't know what else to do at this point to get it out there.
Say it, share it, tell your friends. And you know, because you are there. You are one of his advisors that
right there. I talked to the domestic policy chief, the chief of staff, Dr. John Fleming. I have spoken, and this is 2 years after I've been speaking with other Republican leaders who are crafting healthcare responses that have been saying for 2 years that we will not ever realistically or support a plan or, that doesn't cover pre-existing conditions. So that to me should be off the table. In campaign season, it comes up because, fear motivates, they think, or sells, and people who are afraid to lose their coverage, I understand, may vote based on fear. And people are afraid right now, I think, that they can't afford health care. They are afraid that they will lose their access to health care. And it's because of the way our system is structured, though. And I believe with more choice, more availability of quality physicians and lower costs, that people will have options and they will not be left adrift.
Well, and I think they forget what choices they lost with the ACA.
Right.
And
keep your doctor. You can keep your plan. I mean, none of these things ended up being true. The Affordable Care Act is absolutely a death nail to private physicians' choice and a preamble to socialized healthcare.
absolutely. And but at least the cost went down for everybody.
No, not that either.
That's right.
It's a misnomer.
So it really was a big lie.
Yeah.
Well, I am insuring my kids though. I mean, or at least I'm available, or I'm able to insure my kids for longer. I don't know
Yes.
that, that's the worst thing either. So, so ACA did not do the things it promised to do, but there are a few aspects of it that I think people do like covering pre-existing conditions. So can we ditch that thing, but hold on to those few things that a lot of us like, most of us like?
I have to tell you that repeal and replace is not words that are being utilized by anyone in leadership these days. The Affordable Care Act, otherwise known as the current healthcare system, is deeply entrenched in what as we know it. In the 4 years that Trump's been in office, he has worked on ways to improve the existing healthcare system without scrapping it, because he does know that would be disruptive to many people and their current situation. So he has taken away the individual mandate, improved some choices, tried to make incremental changes about lowering drug prices, but truly his hands have been somewhat tied by our Congress and some of the deep perverse incentives that I talked about, in which big businesses can continue to make so much money.
Well, and really, this is I guess in the ads, in the Democrat ads, they do talk about repeal of the ACA, but really that really is a very big distinction between Democrats and Republicans. And you started with us tonight by saying the alternative is unacceptable and frightening. I can't remember exactly your words, but what does that look like if this continues? But as long as the Democrats control the House of Representatives, the U.S. House, they're going to hang on to the ACA and most of its form. And so
Biden clearly said in the debate he would expand and increase Obamacare. And I have no reason to believe that is not the case. A majority of the Democratic delegates said that they would only vote for a candidate who supported Medicare for all. And let me tell you, Medicare for all is choice for none. Medicare for all is a complete government takeover of healthcare. As it was written so far, the law that is on the books prohibits any private practitioners. There will be no physicians to see patients. There will be absolutely no choice of who to see, how much it costs, what type of care you get. There will be less quality because you will have less trained physicians. Because why am I going to go and sacrifice my entire youth and family and career to be a physician when I could be something else and get paid the same? I am quite honestly terrified to see what might happen if Biden/Bernie and the socialized healthcare plan is our laws in 2021.
So frequently, Dr. Tipton, frequently people want to point to other countries that have socialized medicine as it's working there. Right. And we're America, so we can take some of the worst ideas ever, but because we're America, we can somehow make some failed policies work. But what does it look like in other countries that do have socialized medicine? Is it better?
A lot different than here. I really believe that the average American just has no idea. I mean, people who are covered on Medicare with $3 copays, who can go to the ER whenever they want and demand whatever expensive medication they want with no out-of-pocket costs, certainly have no concept of the true cost of healthcare. And to arguably, many people who are covered with private insurance also have no idea of the true costs. But when that care is rationed by people who, by the way, are not physicians and certainly don't have your best interests in mind, there will be less access, less physicians, and that is what's happening. My sister lives in UK. She has in Northern England. She has 4 children who live there with her now. And the stories she tells me literally daily about how difficult it is to get even the littlest bit of access for any medical condition, like an infected tooth, strep throat, much less psychiatry or counseling services, is sad. And she has double coverage. She has this private insurance. There's just no doctors who even take private insurance. So the NHS is your only choice, and it's a nurse after a 6-hour wait in the ER is what you're going to get. People just have no idea what that would mean to America. So I think if they did, they would not be voting potentially the same way that they are in the fall. So socialized medicine is less choice, less quality, and higher costs through taxes.
And let's not forget the innovation and the quality that comes in any competitive market. The race to cure cancers, the race for to find a COVID vaccination, that happens in labs and happens in the R&D aspect of healthcare. And
I'm not anti-pharma. I mean, we have some great pharmaceutical companies that have had to rein things in quite a bit in the last years because of some regulations. So they do serve a purpose. It takes a lot of money due to our FDA and some outdated policies and patent evergreening and that sort of thing to bring medicines to market. But that's important, for us to have life-saving and cutting-edge technologies that are not available in any socialized medicine country is a reason that we have the best quality healthcare, and that takes money. But what we don't need is middlemen and bureaucrats sucking up all my time in the exam room and your money at the
paperwork.
Pharmacy. Yeah, 50% of physician time, 50% of my job, Kim, right now is clicking boxes and checking off things for the government so that I can get paid a pittance.
50%. And that is time you're not working with the patient. So that is cutting your time as a practitioner in half.
We could double our physician workforce just by deregulating practice.
That is insane. Okay, so just so everybody knows, I do understand the role of socialized medicine does not work. Okay, we just have a few more minutes. And so I need to first ask you, I was listening to, I'm going to give props to one of my favorite podcasters right now. His name is Tim Pool. You can find him at Timcast. And he was noting that how we've got these amazing doctors now in the world who have diagnosed that President Trump is really, really sick because he didn't tweet. Not sure that he's really better because he did tweet. So how much do you base a patient diagnosis and prognosis on how frequently they tweet in a day?
That has never been on my list of diagnostic certificates. I don't know. But Twitter is full of medical professionals these days.
Oh, okay. And you know what? I can't even believe how many people call you out and say, Dr. Mary Tipton, you don't know what you're talking about. And these are people that, are not, it's social media world. They're not medical practitioners, but you can't possibly know what you're talking about. You just went to medical school.
Yeah.
So, okay.
One doesn't have to go to medical school to read data and interpret tests. You just have to, read, think, have a bit of an open mind and just study the science. So that's what I try to say that I do. I happen to be a physician, a chemical engineer, a mother, an Air Force spouse, a business owner, and some other qualifications.
Doran, did you know that? Did she say chemical engineer? Did you know that part?
No. Yeah. That's amazing.
How'd you hide that? Okay. Chemical engineer. So you're an underachiever.
Yeah. So I have a little bit of experience, and I'd be happy to speak on my areas of expertise, but I will never pretend to be an expert in areas that I am not.
Okay, so let's talk about this, though. We have come so far since we first heard about this disease before it hit our shores, and full blown a whole range of reactions from the government to business to education institutions, and my gosh, so I remember being up till about 2:00 in the morning texting with you, Mary, when you were concerned that you couldn't get PPE. You could not protect your employees from patients and vice versa. And then on the heels of that, you were trying to create some drive-through access to testing and services, but then you hit up against local city ordinances that wouldn't let you put the right size canopy in the winter, the late winter, early spring. And I thought, my gosh, and yeah, 2 a.m, and I'm thinking you have already been working 18 hours, and you just want to get government out of the way so you can see patients. And we were so very scared back then. We did not know much at all. We just knew, people were dying. People in New York were dying. People in other countries were dying. And now, like you just said, you're someone who's open-minded and you read the data. Unfortunately, I think unfortunate about the time that we live in is there's a lot of research and there's a lot of garbage research, and sometimes people just have a hard time wading through and knowing what to trust. But it seems like for everything, one research, one study says hydroxychloroquine is one answer, and another one says no, it's not, and don't prescribe and don't fill it if you're a pharmacist. And masks have this research, but you can find the contradictory research. What do we do as citizens who just and then it's fighting, and you've seen it, in your social media where people are attacking you, saying you're wrong. And so much politicization of the disease, of our responses. Such a crazy time to live. I don't know if I've ever seen anything like it, not just the disease itself, but the uncertainty.
Very challenging, as all of those roles I told you, except I'm not a chemical engineer now, but to be a physician, a mother, a business owner during this pandemic, I have experienced a lot of the ups and downs and the challenges. I do believe we're going to get on the other side of it, but it's not going to be nearly as fast or as clean as we would have hoped early on. I think that's absolutely clear. I've been happy over and over again that I'm in private practice and that I can fairly rapidly pivot and address the needs of our patient population better than an employed, corporate physician group could. So I'm proud of what we've done. Like you said, we are running actually 3 simultaneous outdoor clinics right now. We're doing flu clinic drive-by. We're doing coronavirus testing. We're doing evaluation for sick patients. And that's on top of a completely full schedule indoors. So we have really, I think, responded at my business the best we could. And I think the American people on the whole have as well. You have to take the media out of it, I think, because it's just a scary, crazy, wackadoodle world out there. But the patients that come to see me are very grateful for any sort of true information, and they're very, on the whole, very reasonable about the choices that they're making for themselves and their family. And given the appropriate information with their eyes wide open, they are able to make reasonable choices to balance out the effects of potentially being infected or potentially having consequences from restrictions and lockdowns and that sort of thing.
Tell me, knowing now what you, or if you knew 6 months ago what you know now, would you do anything different? Would you advise your patients any differently? Would you have advised the president any differently?
I would.
That is the hard question, not to put you on the spot, but I think we'll all ask that question for years maybe to come.
Yeah, agreed. I think the administration's response to coronavirus has, in policy ways and in action, been exemplary, but in communications and perhaps tone and example, been lacking. It could have been better, meaning, President Trump could have been more forward or direct about promoting masks, for example, and I don't think that would have hurt his credibility, the other side, or, there's different ways of communicating it. But I do feel like the things that they have done to help small businesses and people have been really above reproach, in my opinion. Now, personally, I definitely supported lockdowns early on. I think we made the choice that we had to, except I also think that things need to change over time, and that you have to kind of assess the length of time that this will go on, the realistic strategies to get out of it, and what the cost of those will be. And so that's an ongoing process. And I just appreciate those of you who are in the legislature making those hard decisions and public policy choices. At least I just have to make them on behalf of my family and my business, and that's enough responsibility for me.
There is quite the debate out there about the governor issuing an emergency declaration, which essentially takes those decisions away from the legislature. Not a fan, really pushing back on that. The healthcare departments also have a big role, and court-supported authority in a lot of cases, but we are seeing a lot of that roll back now. We're seeing some court cases that are saying, legislatures probably shouldn't have given their governors their authority, and then governors shouldn't hold on to it as long as they have. This is a slow moving, it's not an earthquake. It is a long-term thing. And so for the legislature really not having the ability to come together and discuss risks, potential responses, a whole range, there's a pretty good segment of the population that is ready to give the legislature their authority back, and let's start talking about lots of options and not just one person.
I really support that our current president has done was to give the states more control, and similarly, I think that our states should give the individual counties and legislative bodies more local control. The more local control, the more in tune the policies can be to the situations that are right in front of you.
I do like that about our president, that he exercised a good amount of federalism right there, and that the governor did really leave it up to local. It's just not crazy about my local. I would like to change that government quite a bit this election. Another plug for Trent Staggs for Salt Lake County Mayor.
Yep.
But what would you have us? We just have about another minute here. What advice do you have? Because we have tried to consider: is there a balance between health and economies and risks and benefits? And I think because it's gone on so long, we are, a lot of us were done a long time ago with the impact on the economy. But here we are, and we're largely reopening. Governor did just order some areas of the state back to orange because of case counts. And oh my gosh, we do have some disaggregated data on the case counts, and they're not they do not equate with an increase in deaths and hospitalizations and ICU admissions. So a lot of these in September, early October, we're seeing those as students who have gone back to school who are mandated to be tested, but really aren't experiencing severe illness, and we're kind of managing. When we started this months ago, the objective was to flatten the curve, not overwhelm the system, but the objective never really was have no cases. And so now we're responding, and we're reacting to when there's a spike in cases. We're going to see cases. I mean, how long are we going to see cases?
Forever.
Forever.
I think 3 years. Hopefully someday we just won't get a tweet on our phone every day of what the 24-hour count is. This is tough questions. I certainly don't have the answers, but I'm glad some people are speaking up enough to ask, because crashing down our economy, keeping children at home, decreasing access to healthcare services, making people literally depressed and crazy has a real health cost. Real.
And
And so I wish we had better ways of measuring it. I mean, I think cases and deaths are just so easy to make a graph about and to measure. And the data is coming out a little bit, but it's just difficult about the cost of the policies that we've implemented so far. And so I just pray that as we keep moving on, we can continue to have people who are wise enough to balance those two things and not be swayed one way or the other into the extremes, because coronavirus is a terrible disease to have personally. I'm sure it can kill you. It should be respected. We should protect all vulnerable people, and we should take it seriously, and we should have the ability to treat it in hospitals the best we can. But we should not absolutely live in fear of this virus and let it take over what I believe will be many years of this pandemic to go.
well, before coronavirus, you and I were talking about some other things that really have been troublesome in healthcare, and opioid addiction and abuse. I mean, that's what before coronavirus, we were talking about opioid substance abuse. There have been recent court settlements and court actions on the pharmaceutical companies that addicted a nation.
Harm potential of their
Yes.
product.
And with incentives to prescribe these drugs. And I mean, I have dealt with it firsthand and intimately in my family. We were also talking about rising mental health concerns, suicide rates in Utah as high as they are. And those things kind of got swallowed up by coronavirus, but not only do they still exist, but in some ways coronavirus has, and our people losing jobs, people having their incomes reduced, people told to stay home. We're even seeing some increases in those things. So, that's one unfortunate thing so many unfortunate things about this pandemic, but is there are people that are still suffering in so many ways that coronavirus swallowed them and maybe even hit them harder because of some of these challenges. So we're going to, we do need to turn our attention back to some other things in healthcare. But I love that
in the exam room, that is what I do every single day, is take care of those problems which are amplified and worsened by the current pandemic. And it's hard to watch that suffering on a daily basis.
Are those questions you ask a patient? How are you doing? Are you
Every day.
with?
Yeah, I literally open, like I see patients, maybe I haven't seen them in 6 months, a year, and I say, how has coronavirus changed your world? And then they launch in and tell me. And it is astounding the extent to which it has affected every single person in ways I couldn't imagine, with their job, their economy, their family, their substance abuse, et cetera. So I feel like I am privileged, but also potentially carry that burden a little heavily of the adverse effects of the shutdowns and the current policies. And for sure, we haven't had the worst of them in this state. I mean, my heart just goes out to the people that still have their kids at home in San Francisco or New York. I honestly can't imagine the travesty that is going on there. So I see both sides, and I just want to speak up for my patients and for my business and my own family, that we have to keep pushing through, and I think America will prevail. And the best president to do so is President Trump. We should reelect him in less than 1 month. Nobody's perfect, but the alternative for sure is a scary proposition. So thanks for having me on.
Thank you. One last question, because like I said, I don't know that you were super political before, but now you're an advisor to the president. Any personal impressions you'd like to share, not just policy, but about our president?
So every single person I have come into contact has told me how hard he works. I basically wanted to smash the TV when Biden was saying, "You're go golfing all the time." I really believe he probably almost never goes golfing. I mean, I was sitting with Congressman Matt Gaetz at an event in July, and I asked him, like, what's it like to work with the president? And he said he legit calls me at 3 a.m. and says, "Matt, what's up? We got to do this. We got to do that." I've spoken with other people who work directly with him. He really, really is sharp. He really, really cares about the American people, and he does work very, very hard. I don't believe those photos were staged one bit at Walter Reed. I have no doubt the doctors were like, why don't you lay down a little? And he probably was just like, I got things to do here. He's working. So I've been extremely impressed with the people that I've worked with in his administration. People definitely will have their opinions about Trump, and they're entitled to that. I can say just firsthand is the people within his administration that are enacting the policies for the American people have been universally amazing. So impressive, so hardworking, so dedicated, and it's been an honor to be involved with them.
Well, thank you so much for representing Utah to the White House and working hard. And I also know I've had text messages with you at 2 and 3 in the morning, so I know how hard you work. So thank you so much for joining us on your, day off. Not that you really get a day off, but
it was a busy day.
It's.
I could just mention some of the physician groups that I do work with. So I work with Physicians for Reform. That's one of the groups that's been partnering with the Job Creators Network to create the Healthcare for You proposal, which is a large part what President Trump's plan is based on. I'm also part of a coalition of practicing physicians and also patients under Free to Care. It's free in the number 2 care.org. And then my Twitter handle is MD, capital MD Tipton MD.
Okay, follow Dr. Mary. You'll get great information, real time, and from someone who is on the front line in healthcare. So thank you so much for being with us tonight, Mary and Dr. Tipton. And we've got some other great guests later this week. Let me just mention we've got Stanley Kurtz is coming on in our next podcast, and we're going to talk about the the far lefts, their efforts to kill your community, destroy your community, eliminate single-family housing, all kinds of things. So we're excited to have him on next week, or in the next couple days here. And Doran Barton, our producer, thank you so much for being with us again.
You're welcome.
All righty. Hope to see you next time. And Candidly, Kim, have a good night.